Understanding asthma, a common breathing condition that affects people of all ages. Asthma is a chronic respiratory condition that affects millions of people worldwide, including a significant number of children and teenagers. It is one of the most common chronic diseases in children. This condition primarily affects the airways, which are the passages that carry air in and out of the lungs. When these airways are affected, it can lead to symptoms like wheezing, shortness of breath, and coughing. In individuals with asthma, these airways become inflamed and swollen, making it difficult for air to flow freely. This inflammation can be triggered by various factors, including allergens, exercise, and even stress. Imagine the airways as flexible tubes that allow air to pass through. In asthma, these tubes become narrowed and constricted, making it hard to breathe. This narrowing is often temporary but can be recurrent, occurring periodically, and varying in severity. During an asthma attack, the muscles around the airways tighten, further restricting airflow. This narrowing is often temporary but can be recurrent, occurring periodically, and varying in severity. While there is no cure for asthma, it can be effectively managed with proper medical care and lifestyle modifications. While there is no cure for asthma, it can be effectively managed with proper medical care and lifestyle modifications. Medications, such as inhalers, can help control symptoms and prevent attacks. Asthma is a common condition, especially among children. It is crucial to understand that asthma is a manageable condition. With the right treatment plan, children and teenagers with asthma can lead active and fulfilling lives. Regular checkups with healthcare providers and adherence to prescribed treatments are key to managing this condition effectively. The telltale signs: recognizing asthma symptoms. Recognizing the symptoms of asthma is crucial for early diagnosis and effective management. Early detection can significantly improve the quality of life for those affected. Common symptoms include wheezing, a whistling sound produced during breathing, particularly when exhaling. This can often be heard more clearly during physical activities. Coughing, especially at night or early in the morning, is another telltale sign. This persistent cough can disrupt sleep and daily activities. Shortness of breath, often described as a feeling of not being able to catch one's breath, is a serious symptom that should never be ignored. It can occur suddenly or gradually. Chest tightness, a feeling of constriction or pressure in the chest, is also common. This can be particularly distressing and may require immediate attention. These symptoms can range in severity from mild to severe and may vary from person to person. Some may experience them occasionally, while others may have them more frequently. It's important to note that not everyone with asthma will experience all of these symptoms. The presence and intensity of symptoms can differ widely. Some individuals may only experience a few, while others may have more frequent and severe symptoms. Monitoring and understanding these signs can help in managing the condition effectively. If you or your child experience any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Early intervention can make a significant difference. Unraveling the mechanism. What happens during an asthma attack? Let's dive into the details to understand this better. During an asthma attack, the airways become inflamed and swollen, leading to a cascade of events that make breathing difficult. This inflammation is a response to various triggers such as allergens or irritants. The muscles surrounding the airways tighten, a phenomenon known as bronchospasm, further constricting the airways and making it hard to breathe. This tightening is often sudden and can be quite severe. The lining of the airways also becomes inflamed and produces excess mucus, a sticky substance that can clog the airways and worsen breathing difficulties. This mucus production is the body's way of trying to protect the airways, but it ends up causing more harm. This combination of factors significantly reduces airflow in and out of the lungs, leading to the characteristic symptoms of an asthma attack. These symptoms can include wheezing, coughing, and a feeling of tightness in the chest. Imagine a straw that is being squeezed in the middle while also being partially blocked by a sticky substance. This visual can help you understand the struggle for air. This is similar to what happens to the airways during an asthma attack, making it extremely difficult to breathe. The sensation can be frightening and overwhelming. Recognizing the signs of an asthma attack and seeking prompt medical attention is crucial for preventing serious complications. Early intervention can make a significant difference in the outcome. Triggers. Identifying the culprits behind asthma flare-ups. Identifying and avoiding asthma triggers is a crucial aspect of managing the condition. Triggers are substances or conditions that can irritate the airways and provoke an asthma attack. Common triggers include allergens such as pollen, dust mites, pet dander and mold. Irritants such as tobacco smoke, air pollution and strong fumes can also trigger asthma symptoms. Respiratory infections such as colds and the flu are common triggers, as they can inflame the airways and make them more susceptible to asthma attacks. Other factors that can trigger asthma include physical activity, particularly in cold, dry air and emotional stress. It's important to note that triggers can vary from person to person. Keeping a diary to track potential triggers and their impact on symptoms can be helpful in identifying and avoiding them. Section 5. Prevention is key. Minimizing exposure to asthma triggers. Minimizing exposure to asthma triggers is paramount in preventing asthma attacks and managing the condition effectively. This involves taking proactive measures to reduce allergens in the home, such as regularly cleaning bedding, vacuuming carpets, and using dust mite covers. Maintaining good indoor air quality is essential. This includes avoiding smoking indoors, ensuring proper ventilation, and using air purifiers to remove allergens and irritants from the air. If outdoor air pollution is a concern, monitoring air quality reports and limiting outdoor activities during peak pollution times can be beneficial. Managing stress levels through relaxation techniques such as deep breathing exercises or meditation can also help prevent asthma flare-ups. By taking these preventive measures, individuals with asthma can significantly reduce their risk of experiencing symptoms and improve their overall quality of life. Section 6. The role of inhalers in asthma management. Inhalers play a pivotal role in asthma management, delivering medication directly to the lungs for quick and effective relief from symptoms. There are two main types of inhalers: relievers and controllers. Relievers, as the name suggests, provide immediate relief from asthma symptoms by quickly opening up the airways. Controllers, on the other hand, are used daily to reduce airway inflammation and prevent asthma attacks. These medications work over time to keep asthma symptoms under control. Inhalers are available in different forms, including metered dose inhalers, or MDIs, and dry powder inhalers, or DPIs. It's essential to use inhalers correctly to ensure the medication reaches the lungs effectively. Your healthcare provider will demonstrate the proper technique for using your specific type of inhaler. Never hesitate to ask your doctor or pharmacist if you have any questions or concerns about using your inhaler. Section 7. Prevalence and impact asthma in children and teenagers. Asthma is a prevalent chronic respiratory condition that affects a significant number of children and teenagers worldwide. According to the Centers for Disease Control and Prevention, about 6 million children in the United States have asthma. This condition can significantly impact a child's life, leading to missed school days, limitations in physical activities, and sleep disturbances. Asthma is a leading cause of school absenteeism, with millions of missed school days reported each year due to asthma flare-ups. The financial burden of asthma is also substantial, with healthcare costs, including doctor's visits, emergency room visits, and medications, placing a significant strain on families. Despite these challenges, it's important to remember that asthma is a manageable condition, and with proper care, children and teenagers with asthma can live full and active lives. Section 8. The interplay of genes and environment. While the exact causes of asthma are not fully understood, research suggests a complex interplay of genetic and environmental factors contributes to its development. Genetic predisposition plays a role, as individuals with a family history of asthma are more likely to develop the condition. Environmental factors such as exposure to allergens, irritants, and respiratory infections early in life are also thought to play a significant role in triggering asthma in genetically susceptible individuals. The hygiene hypothesis suggests that exposure to certain infections early in life may help protect against asthma by strengthening the immune system. Further research is needed to fully elucidate the complex interplay between genes and the environment in asthma development. Understanding these factors is crucial for developing effective prevention strategies and personalized treatment approaches for individuals with asthma. Section 9, Living Well with Asthma, a message of hope. Living with asthma, while challenging at times, should not be a barrier to a full and active life. With proper management, individuals with asthma can participate in the activities they enjoy and achieve their goals. The key to living well with asthma lies in understanding the condition, recognizing and avoiding triggers, and following the prescribed treatment plan. Open communication with your healthcare provider is essential. Don't hesitate to ask questions, express concerns, and discuss any challenges you face in managing your asthma. By working together, you and your healthcare provider can develop an effective asthma action plan tailored to your specific needs. Remember, you are not alone in this journey. Millions of people worldwide live with asthma, and with the right knowledge, support, and medical care, you can live a healthy, fulfilling life despite the challenges asthma may present.